Chou, it's great to see you.
Nice to see you also, Jay.
Thanks for sitting down with us. So, can you talk to me about like how you educate patients? Like, I'm sure they come to you, maybe they think they know what they've got. You've got to help them, right? It's a journey of, right, what they're dealing with and what maybe you can help them with. Yeah, just talk about that. I'm fascinated by that from your lens.
Yeah, I know that's a great question. One of the big questions patients will come to me and ask is they've heard about this thing called the fusion, a spinal fusion. And the real question is, should I have a fusion? Because some people say, you know, I heard this person had a fusion and they did great. This person had a fusion, they did poorly. And so ultimately it comes down to the way to think about a spinal fusion is to think about stabilizing the spine. And it's very important. So for instance, if you're a person trapped under a car and the car is just shifting around, you want to stop that car from irritating you and you want to put the brakes on. So in people who've got that pathology, which we would call instability or hypermobility, you want to stop that motion so that it doesn't irritate the nerve. Another reason people benefit from a fusion is going back to that car analogy again also. Imagine you're under a car and all the tires are flat and you are trapped under the car. Now you can go ahead with a hammer and chisel and try to dig away the metal as long as you can, but you know that in your heart of hearts, the definitive way to get that pressure off is you need to jack up the car.
That's right.
And hold it there so that the person is free. And that's the same with our nerves in our back, a lot of the times, or in our neck, a lot of the time. You physically need to open it up and hold it so that the nerve is not irritated.
Right.
Now, those are great cases for spinal fusion. Another one is basically thinking about if your back becomes the Leaning Tower of Pisa. If your back is the Leaning Tower of Pisa, always going forward, and it hurts, and imagine being held, the tower is held up not by the ground, but by cables in the back. Imagine trying to hold that force every single day, every time you stand up. And those patients, you can do a laminectomy or take a shovel and dig, but it's not going to help long. You need to pull the tower back and hold it in that position with a big, strong brace. Those patients generally will get better with fusion. People who don't really need a fusion are people who maybe you've got a little pinched nerve. So, you know, if you're walking around and there's a basketball that's, you know, all of a sudden is pushing against you, you don't need it. You just need to push the basketball out so it's no longer pushing into your body. So those are the fundamental principles of who needs a fusion. People who have hypermobility or instability, people who have collapse of their spine that's crushing their nerves.
Yep.
And then people who have malalignment or things that are not where they're supposed to be in their spine. But usually pinched nerves or tiny little disc herniations or things that basically that are focal, pushing on the nerve, a lot of times they don't need a fusion.
Just relief from that compression?
Yes.
Yeah. As we're here learning about these ways in which to treat or ways in which your partners are treating those types of pathologies, why do you come to these meetings? Obviously it's close to you, but like proximity wise, but you're still busy, you got a lot going on. Like this is a dedication of your time.
Yeah, that's a great question. So I think meetings are really helpful in that the personal interaction and the collegial contact with people to learn about what's the latest, what works, what doesn't work, what helps our patients get better, what may just be, you know, a flash in the pan that subsequently goes away. And I think meetings really, really help all of us learn about spine surgery and help our patients get better and get better care in the long run.
Yeah, that's well said. Do you have a favorite surgery that you personally enjoy doing?
Yeah, that's a great question. So I personally like doing surgeries that I know have a great chance of helping the patient. And that's really, really important because a lot of times some of the surgeries that are done, they may not be that beneficial in that it's uncertain if they will have a high success rate. So for instance, patients who have pinched nerves, generally, however they're unpinched, whether it's a laminectomy, a little roto-rooter kind of a decompression, whether it's a fusion, whatever it is, usually those patients will get better. So, and to your point about favorite surgeries, I do think that minimally invasive spine surgery is a great way to do surgery if you get the same outcomes. It's very important. As long as a patient gets the same outcome and same results, I think it's a great operation. Because the concept of minimally invasive is you're doing the same surgery, but the damage to the human body on the way in is dramatically less. So for instance, a lot of these fusions can be done through a very, very tiny incision, whereas in the old days, we would have to do a very, very large incision. So it's shorter recovery, less blood loss, fewer complications, and they're not in surgery for such a long period of time.
So where do you see this going? Future, like what? And nobody has a crystal ball, but right, there's a lot of innovation here. There seems to be a precipice of a lot of enabling technology, AI, ML, data. However, right, techniques and some things that have been around for decades are still very much standard of care. So where does this go in your OR or in spine, as a whole?
Yeah, no, that's great. So I think that the technology has really made it so that spine surgery is better, safer, and more effective. The other thing that I think is important about technology and AI is that the dissemination of information is so much better. So if surgeons know that these are the great outcomes that we want to achieve, this is what a patient who gets a procedure X should get an outcome Y. And I think that has really raised the bar for everybody. That people who have back surgery, the bar should not be low, but it should be very, very high. And if it is low, the patient should be aware that, hey, this is not a successful operation,
right?
Because now we know why. And so they know upfront going into the surgery, they say, I get it, it may not be as successful, but this is what I want to try first before doing some other operation. And then the technology has made it so that the spine surgery is so much safer than it used to be.
Yeah.
Just the decompression is so much safer. The placement of instrumentation into the spine, if necessary, is so much safer. It's so much more accurate. The biologics, meaning the ability for the spine to heal, are so much better, just orders of magnitude better. So in the past 10, 20 years, spine surgery has gotten way, way better, way more effective, and most importantly, way safer for patients to have.
Well, it's exciting to meet people like you doing things for your community, for the spine industry as a whole, and grateful and honored for this opportunity to meet and sit and chat. It's awesome to see there's so many people that are really trying to improve the lives of each patient, right, one at a time. So
yes, thanks for your time.
You bet. Thank you. It's great to meet you.
Nice to meet you also.